and welcome to the next edition of the Academy by Acclivity Health Solutions. I'm really excited about today's opportunity to chat with you all because it really is a conversation around how does one get ready or get started within value-based care. We've hung around this problem most of our careers at Acclivity, and one of the things that you get to know are the people and the processes that work. And I'm really happy to share some bit of content that was first exposed to the market through a good friend of mine, Katie Lands. And she brought this to life in front of an audience at Home Care 100 last year. What I like about it is the clarity it brings to the table. It really allows for you to have a conversation around your board, around your senior leadership teams, around your staff, that really start to set the stage for what it looks like when you're going to succeed or build the infrastructure to succeed in value-based care. So I like to orient myself at the bottom of this slide. It really is a look at, okay, what today has your team built relative to being able to work across service lines, to understand patient journeys, to be able to do clean transitions and handoffs. And that starts potentially with even technology, having interoperability capabilities, having integration capabilities. It also works within your intake admission access teams, understanding how to sort of manage and measure journeys across service lines. If you move up the stack from just basic interoperability in both people, technology, and process, you move into more common, particular capabilities that have to be in place. Many of these organizations that are standing up value-based contracts like Medicare or Med Advantage focus on technology capabilities meeting ONC requirements. So if you're not familiar with ONC, it's a certifying body. Most of your capabilities need to meet ONC 2015 specifications from an EHR perspective. So look into that if you're unfamiliar, or reach out to us and we can tell you a little bit more about where to look and how to find the rocks to turn over to find the good treasure. So EHR connectivity is important. ONC certification will be a requirement in some of these opportunities. From there, you need to think about, okay, so data that I enter into my EHR is only part of the story. What about paid claims from all locations of care, all types of services, all diagnoses, all problems, all interactions, encounters, episodic care, et cetera. Those typically come in the form of claims and clinical data commingled in an analytics framework. So you need to have that foundational component in play. Then you need to be able to communicate about patient journeys. And often that communication might be across interdisciplinary teams. So set up a nice interdisciplinary team meeting approach and process. Then think about patient engagements, models of care that allow for you to see patients throughout their journey from different institutional settings all the way back into home settings. And then lastly, once you're able to sort of pull all of those things together around individual patients, you have to move up the stack and start thinking about population health itself. So we often talk about, okay, which patients need access to your most precious resource, your clinical team, and how do you prioritize by acuity, severity, frailty, prognosis, et cetera. That's population health management. And then last, your most important resource we talked about is often the clinical team around the table. How do you infiltrate that team with an approach that allows them to be used at the highest level of their license? How do you ensure that approach drives the best clinical outcomes, marrying those outcomes to financial outcomes? And then how do you do that over and over through iterative back and forth work across the population? That's the stack. We often think about like, okay, do a readiness assessment, understand where you have strengths, a SWOT analysis, where you have strengths, weaknesses, opportunities, and threats. We think about looking at each of these pillars on this stack as an opportunity for improvement. Even if today you have a good foundational EHR, even if today you have analytics and communication and IDT teams working, are they built for value-based care? Are they built for a single service line? Are they built for something that really doesn't align to payment reimbursement models that are tied to quality, cost, and utilization? So this is a good thought piece. It's a wonderful expression by Katie Lands of how it all gets put together and comes together. Looking forward to actually chatting with you all more about this, and maybe a podcast with Katie and I just chatting through the real details underneath this beyond more than a 5-minute discussion here. Probably pays dividends. If you have those kind of podcast suggestions, or if you'd like to see other capabilities make their way into the Academy, as always, info@acclivityhealth.com. Thank you and have a great day.